Welcome back to my channel, Pattern of Good Works. My name is Donna, and today we will be in chapter number 5. And the book that we're reading is The Specialty Practice of Rehabilitation Nursing, a Core Curriculum, the 8th edition. So on page number 73, it says, evidence-based practice, which is better known as EBP, is the process of finding, appraising, and applying scientific evidence to the treatment and management of healthcare, and the discovery of underlying trends and principles developed from the accumulation and refinement of a large body of studies. Woo, that's a mouthful. So in 2023, June 1st, there was an article from ANA that said, what is evidence-based practice in nursing? Evidence-based practice in nursing involves providing holistic, quality care based on the most up-to-date research and knowledge rather than traditional methods, advice from colleagues, or personal beliefs. On page number 74 in the book, it says the Association for Rehabilitation Nurses, CRRN, Competency Model for Professional Rehabilitation Nursing explains the need for rehabilitation nurses, whether novice or experienced, to use current evidence and supportive technology when delivering care to people with disability or chronic illnesses. So what does that look like? So for example, many years ago when I was practicing at the bedside, or when I started practicing, we didn't have alcohol impregnated caps. We didn't know to scrub the hub. All of this information came about to prevent central line associated bloodstream infections, which are better known as CLABSIs. So central line associated bloodstream infections happen. And what did they do? They looked at the problem. They looked at all of the entryways for a pathogen to get into a line. And they found that if nurses scrub the hub for 15 seconds, that can lessen the likelihood of an organism entering when nurses access the line by utilizing the Luer lock device barrel syringe. So they also found that to keep the line clean, it would be helpful to put an alcohol impregnated cap on it. So we have various products on the market now that are impregnated with a disinfectant, whether it be alcohol, there are some maybe with chlorhexidine. All of these kits came about to prevent that type of infection from occurring. Since we're talking about evidence-based practice, we should define what is evidence. So according to CEBMA's website, they say evidence in general means information. It's facts or data supporting or contradicting a claim, assumption, or hypothesis. Like the use of evidence in legal settings, in fact, anything might count as evidence if it's judged to be valid, reliable, and relevant. So now that we know what the evidence is, it's good to know the evidence hierarchy. We could take a pyramid and we can take a look and see what's at the top of the pyramid and what's at the base of the pyramid. So for evidence, we have usually at the top systematic reviews. Then we will have critically appraised topics or evidence synthesis and guidelines. Then under that, you will see critically appraised individual articles or article synopsises. And then under that, that's filtered information. Under that piece of the pyramid, you'll see randomized controlled trials, better known as RCTs. Those are the gold standard. Other than that, you'll see cohort studies, case-controlled studies or case series or reports, and then we'll see background information or expert opinion. Case reports and expert opinion will always be at the base of the pyramid, and at the very top of the pyramid, it will either be systematic reviews or what we also know as meta-analysis. The studies that produce high levels of evidence will be on the top, and on the bottom will be studies that produce lower levels of evidence. Again, on page 74, there is the Stevens STAR model of knowledge transformation. And the first point of that model, it talks about the discovery research. And then the second one is evidence summary. The third is translation into guidelines. And then the fourth is practice integration. And then lastly, with the fifth, process outcome evaluation. Lastly, be sure to remember when you have a research process to go through that you're always going to want to find out your problem statement. Secondary, you're going to look for your purpose statement and your development. Use of a theoretical framework. Remember, we talked about nurse theorists. What theoretical framework are you going to utilize to underpin your process? You're going to review the literature, making sure that the literature is not outdated. Unless there's no literature on that topic, try to stay within a time frame of 5 years. And then there's a choice of a method. Always protect your human subjects. There will be data analysis and results. And lastly, there will be a discussion of the results. If there's limitations, you should also include that as well. I thank you this week again for going through the research process with me, looking at evidence-based research, and also taking a focus and thinking about in your everyday practice, how are you utilizing evidence-based practice to keep your patients as well as your staff or your coworkers safe? So thanks again for coming along on this journey for the CRRN examination. We hope to see you next week. Wishing you all the best. God bless you and be well.